I'm Michael Dickinson from MacCallum Cancer Center and Royal Melbourne Hospital in Melbourne, Australia, and I'm here in Lugano, and I'm presenting a study of RG6146 in combination with venetoclax and rituximab in relapsed and refractory diffuse large B-cell lymphoma. For some time, people have been really interested in the role of epigenetic agents in lymphoma, and in particular the BET inhibitors. These target BET bromodomains, which appear to be important in cancer cell survival. They have a range of effects, and there's preclinical evidence that suggests that the combination of BET inhibitors with venetoclax would be particularly advantageous. There are hypotheses around targeting MYC, and of course we know venetoclax targets BCL2. And there are other hypotheses around BET inhibitors ameliorating resistance to venetoclax specifically, and also the immune effects of BET inhibitors. And so this clinical trial was looking to explore these hypotheses that have come out with multiple preclinical investigators in the clinical setting. RG6146 is based on the preclinical agent JQ1, and it's given subcutaneously due to favourable pharmacokinetic profile, and in that way it differs from other oral BET inhibitors. So in this clinical trial, which was a classically designed cohorts of 3, we looked at escalating doses of venetoclax and RG6146, and then once the dose was established, added rituximab to have a triplet. And I reported the initial results of this phase 1 clinical trial. The results were quite interesting. We recruited a very refractory and heavily treated population of diffuse large B-cell lymphoma. The study was designed in a way that enabled patients to get onto the trial quickly. What we saw in the 33 patients who were evaluable for response was an overall response rate of 45%, which is really very interesting signal in this aggressive group of histologies. There was a complete remission rate of 24%, and remarkably for aggressive lymphomas and for diffuse large B-cell lymphoma in particular, some patients had a sustained duration of response, with 8 patients experiencing a response of more than 90 days, which is quite remarkable. So that if you had a complete remission on this combination, it was relatively sustained in this aggressive patient population. Now, the key side effects were diarrhea, nausea and asthenia, as well as thrombocytopenia that we saw, and these were generally manageable and did not lead to sustained treatment discontinuations. Now, so overall, this study was a really useful proof of principle of these preclinical hypotheses that we do see activity in aggressive lymphomas, and some patients enjoy a sustained response to therapy.